Hi everyone, thank you for coming. My name is Dylan Brown and I'm a registered nurse. I graduated from St. FX in 2012 and I'd like to talk to you today about evidence-based practice as a registered nurse. So my experience was at the operating rooms at the Halifax Infirmary. So I reviewed some research through the perioperative nursing program that I took on perioperative hypothermia, and I decided that I should take the information that I'd learned and make some changes to the preoperative routine at the Halifax Infirmary, particularly in orthopedic and neurosurgery where I worked. So I went back and I tried to do that, and I encountered a number of barriers, and I'll talk about those today. The first one was a lack of knowledge, both on the part of the registered nurse, the anesthesiologist, and the surgery team. There was no knowledge of the greater practices that were out there at other institutions, and there was really no questioning of the established routine at our institution. The other major challenge that I had was a lack of role clarity amongst those three disciplines that I just talked about before: the registered nurse, the anesthesiologist, and the surgeon. We've all had distinct tasks in the preoperative routine that were set out as either the task of the RN, the anesthesiologist, or the surgeon. So we functioned mostly in parallel to one another rather than as a functional unit. So that was another major challenge. Another big part of that lack of role clarity is on the part of the registered nurse. They don't really seem to see themselves as someone who can go out and do research or review research and make recommendations to practice. But as you as registered nurses know, you took the classes in university, you took your research methods, so you have those skills and you can do that. But that is a skill set in practice that is majorly underused. So those were the two major challenges that I had, and I can offer a little bit of advice to registered nurses who are trying to make some changes to practices rather. The first is that when you find something that is not right about the practices in your institution, or you find an enhanced practice, you need to find out more about the system or about the situation. You need to go back to your colleagues and find out the rationale for the current practice, and you need to figure out all the obstacles that are in place that you're going to have to overcome to change those practices. Secondly, you need to take a systems approach to change. What I mean by that is you need to come up with solutions or work to find solutions with your colleagues that not only benefit patient by patient, but benefit the system as a whole and are conducive to success for all disciplines. Those are my two big pieces of advice, and that's my experience with evidence-based practice. Thank you to all for coming today, and thank you to Dr. MacDougall for having me. Happy X-raying.